excited to share my perspectives, especially as a non-clinical doctor. I'm focusing on the medical needs of mainly on children and families as well as professionals. So I'd like to unpack the concept of diverse and also try to raise a little bit of awareness. And I'm sure there is awareness, but then I want to emphasize on how important it is to relate to that. Let me see how this works. Okay. So I'm not going to read through all my presentation slides. I just thought I will highlight the key aspects. So again, emphasizing on the diverse aspect, I'd like to emphasize that children, their families, and even professionals do come from different backgrounds. And I would like to add on to their experiences, individual needs of children, because the focus is on pediatrics here, the context, their backgrounds, and also trying to highlight the complexities of individual child's medical conditions that needs to be considered from the perspective of all these aspects that I mentioned: experiences, needs, context, influences, and the backgrounds as well. So I've got little very brief recent data, and then I've highlighted generally the minority groups. I've got ethnic groups, but then underneath I've also focused on the different attributes, different categories that is often related to as a child. But then what I would like to highlight is the bottom bit, which says health patterns differ significantly between ethnic minority groups and the white population, and between different minority groups, probably within the minority groups as well, depends on where they come from. And reflecting the diversity of demographics, socioeconomic, behavioral, cultural, and other characteristics between the ethnic groups. And yeah, and also I'd like to emphasize on intersectionality, on how a child is, it's important to look at the child not from the perspective of an individual label, especially relating to the medical condition. It's important to make those connections with the other attributes of the child to establish what is the individual need in terms of the condition of the child. And also I'd like to highlight visible and invisible as well. I'll come back to that in a little while. So these are the general categories that we're all familiar with, but then how much of this do we take into consideration when we are looking at an individual child is, I think for me, it's intriguing as a non-medical doctor. Although I've had in my own, with my daughter, I've had some experiences of this. If I have time, I'll come back to that. This is from one of my publications. So my question is, a child can have different labels put on the child's face or on the child's name, for example. But then is the child behind the label who is important? Is it the child or the label? And I don't know. I suspect perhaps that do we give more importance to the label of what is the diagnosis. I'm sort of aware of the time pressures of everything, of all the medical professionals, but I'm looking at, when I mention intersectionality, is how all those different categories actually are seen as different layers and how they actually become a good pattern wherein you're trying to diagnose or treat this particular child. And then how you weave these different layers or attributes can actually enable for a successful treatment of the child, I think. And generally, looking at the visible and invisible diversity, I strongly believe that diversity, we often take diversity for granted, and then all the visible diversity that we can see, we tend to put all the visible diversity under an umbrella and then perhaps overlook some of the complexities or some of the people who, or some of the children who might look white, but then their needs might be different, or their medical needs might be different to what we tend to believe that this is what the child is about. Okay, and then the disadvantage of having visible and invisible diversity is that lots of the time we might mask the needs of the child, or we might make assumptions that this might be the reason why, or this could be the way we could treat this child, perhaps. Just a thought. And I'd like to explain this model of awareness of diversity. And then this is actually inspired by Johari Window. And then on the first box on the left, it's actually this individual as a professional. They could be open and free in terms of their stereotypes and the prejudices. They are aware of what do they know, and are we open and flexible to adapt to new information. So in terms of, if I understand that I'm stereotyping or I was stereotyping, and because of that I'm prejudicing this particular child, then when I learn that information, I'm open to adapt my knowledge and understanding. Also, I'm relating that to what is politically correct and what are the attitudes towards diverse population. So underneath that, some of these professionals, they could be aware that they are prejudiced, but then they might be putting on a mask, feeling that they are not prejudiced. They are actually trying to do what is necessary. But then that mask may not be actually felt or known by others. So on the right-hand side on the top, you could see that there's a blind spot, which actually relates to the fact that the professional may not necessarily understand, or there could be unconscious, it could be an unconscious bias, they're not aware. And then that could be relating to lots of religious diversity or ethnic diversity as well, if they come from totally new backgrounds, or cultural diversity for that matter. But then some of this prejudice could be strongly felt by who has been receiving this prejudice for that matter. On the bottom right, we could see that the information of the individual is actually informed by the stereotypes and prejudices that has been in the community, or it's been entrenched in the community for a long time. But then sometimes we feel that we do not know that this is wrong, our thinking is wrong. And then we also believe that because their children and their families belong in the same community, that is acceptable. But then I feel that this individual who has been prejudiced would certainly feel that, although we have put it in this box of unknown by myself and others as well. Any questions, I'd be happy to answer them. And so I think one of the things I'd like to, when we are meeting needs of children and families from a medical perspective, definitely we should not believe that one size fits all. Maybe we should be focusing on the diagnosis, we should be focusing on the treatment, appropriate treatment, and I've got the heterogeneous needs of children and families needs to be considered. In terms of, if I give an example, if a child comes in with a parent who is unable to articulate the needs of the children or what is the child suffering from. And then if that is misunderstood, then, or if that understanding of the child's condition is different to what the child is suffering from, that can create an inconsistency between the diagnosis and treatment and lead to other complications. So from the professional conundrums, as a professional, some of the dilemmas or challenges faced, I'm not going through everything because all of them, you're all experiencing that. And then again, I'd like to quickly highlight the awareness diversity is something, how much do we know or how much do we need to know or how much should we expect? Who is my next patient coming in and what do I need to know about that person? And then, and how are the professionals providing or facilitating access to services for these children and their families? And positive communication with all families. I was going to use the word being proactive, but then how much can you be proactive can be quite complex, I would say. And I'm a strong advocate of children and also the families. So how do we empower them in ensuring that their needs are met and they live a healthy life? That's important. And I did mention time and funding. I'm not even going in the direction. Personal attitudes for me is very, very important. Going back to my window, it's again, how open are you in accepting that you're stereotyping or you're prejudiced? And I think there's nothing, I wouldn't say there's nothing wrong, or everybody would have some prejudices or other, but then it's relating that we are prejudiced or we are stereotyping, and then unlearning those and relearning the right information is important from my perspective. So I've got some key take-home messages that diversity is heterogeneous in terms of we cannot put all the children that we categorize them like all girls would be this, or all children from the who are considered Black would have this condition. So I think that aspect needs to be understood, that diversity is heterogeneous and every child is a unique individual with their own makeup. And health inequalities related to children and families from diverse backgrounds, and raised awareness of visible and invisible diversity is important. And meeting needs of children and families is challenging, I do accept that. And then more importantly, professionals will have to be open to unlearn and the perspectives that are entrenched in the community and break their unconscious bias and assumptions. And last but not the previous one, the process of unlearning is relearning is ongoing. You can never believe that, oh, I've done everything, I've unlearned all my prejudices and stereotypes, so I'm all right from today. But then it's an ongoing process, because you might realize in the next hour or even 10 minutes for that matter that you will have to start unlearning again. And again, my favorite takeaway message is children, families, and professionals definitely must be empowered. Yeah, that's me, and I've got some references. Thank you.